Welcome to my office. I'm Dr. Don Steensma. This presentation is a brief overview of examination procedures performed in my office. The examination sequence consists of pre-testing by technicians and then an external examination, a refraction, and internal examination that I do. Pre-testing. Pre-testing consists of 4 tests. The autorefractor measures your vision and how your eyes focus. It provides a good starting point for the refraction later on in the exam process. FDT visual fields are looking for health problems. We measure your current glasses with a digital lensometer, and we do an eye pressure test or tonometry. Autorefraction.
This is the autorefractor. I just need you to put your chin right in here, okay? This is going to measure your vision and how your eyes focus on the light. Okay, so I just need you to look straight ahead in there. Are you able to read those letters and numbers? Yes. Go ahead and read those off for me.
CRD 849.
Perfect. And how about right there?
DHB at 928.
Perfect. Now just a moment. I just need you to look straight at those letters and numbers and keep your head real still. Great. Now I'm going to try the other eye.
FDT visual fields.
This test will measure your peripheral vision and help detect eye disease, okay? Go ahead and hold on to this and then put your forehead up against there. Do you see that black square in the middle?
Yes.
Perfect. Focus there throughout the entire test. That will be your focal point. Meanwhile, you're going to see black, squiggly, kind of blurry lines. Each time those appear, just push that button, okay?
Okay.
All right. You'll begin to see a demonstration, but the test has not started yet. It is very important to blink. You should blink often throughout the test. All right. The test will begin right now.
Digital lensometry.
I just received some glasses in for a patient. Now I'm going to measure the prescription to confirm that what we received is exactly what we ordered. And it's perfect.
Tonometry.
So now we're going to check the pressure in your eyes. So what I need you to do is place your chin right here and your forehead all the way against the top for me. And look straight at that light. You're going to feel a small puff of air, but don't worry, it doesn't hurt. Okay, next we're going to check your other eye. Make sure to put your forehead all the way against the top. Perfect. Just look straight. Perfect.
A portion of the examination that I do includes the refraction, measuring your vision, an external examination of the eyes and the surrounding tissues, an examination of the front of the eyes with the biomicroscope, and an inspection of the eye's interior structure with 3 different techniques. Refraction. The refraction is that part of the eye examination where I ask you which way is better, this way or that way, or are they the same? A lot of people stress on this, but they shouldn't. Just tell me what you think, and I will sort it out. The autorefractor gives me a preliminary prescription before I even start the refraction. You okay then? Let's get this lined up. Let's do the left eye first. Which line can you read down there?
The bottom one.
Read it for me, please.
TZVECL.
Perfect. Do you see any difference at all in the way it looks when I do this?
Yes.
Better or worse?
Better.
How about when I do this?
So worse.
So it's better over here?
Yes.
Perfect. Let's try the other side. Which line can you read now?
The second to last.
Which way is better, you think, here or here?
The other way.
This one here.
Yeah.
How about now, this way or this way?
That's better.
How about this way and this way? They might be the same.
About the same.
About the same now.
Yeah.
Let's do this. Two choices. They might be the same, but maybe one's better than the other. What do you think? Here or here?
The other way's better.
This one's better here?
Yes.
Perfect. Let's see you read the bottom line.
TCVECL.
Perfect. The external examination. The external examination consists of 3 parts. How well do your eyes work as a team? Do your pupils appear normal and seem to function normal? Do the structures around the eyes, such as eyelids, appear normal? Biomicroscopy. The biomicroscope is a special microscope that allows me to see the outside of your eye with high magnification. I can examine in detail your cornea, your conjunctiva, your lens, and your iris. Often I'll use a dye called fluorescein. Fluorescein is an orange dye that glows bright green under a black light. It allows me to see any defects in the surface of the cornea. Let's do this next. Come on forward, put your chin up in there, head right up against the bar. How's that height? Is that okay for you?
Yes.
I'd like you to look towards my ear over here, please. This lets me see the outside of your eye up close, so I can look for any problems. I'll look at this over here. And they look great. Good, sit back. The internal examination. There are 3 instruments that can be used for the internal examination: indirect ophthalmoscope, biomicroscope with a focal lens, and retinal photography. Indirect ophthalmoscopy. The indirect ophthalmoscope is an instrument I wear on my head. By holding a lens in front of your eye, I can visualize the inside of the eye. I may ask you to look in different directions of gaze during the examination. Biomicroscopy with a focal lens. A second technique is with a focal lens. With this technique, I hold a different type of lens in front of your eye at the biomicroscope. This technique gives me more magnification, but I do not see as large a field as I do with the indirect ophthalmoscope. Just as with the indirect ophthalmoscope, I may ask you to look in different directions. Retinal photography. The third technique is retinal photography. I routinely take photographs of everyone's retina during examinations. This technique allows the best view of small structures inside the eye, often allowing me to see details I wouldn't have seen with the other 2 techniques.
Now we're going to take a picture of the inside of your eye. This is a digital photograph that'll let us potentially see any health problems that your eyes might have. Okay, so I just need your chin to be placed right there. When you look right inside there, do you see that green light?
Yes.
Just focus on that light for me, please. Okay, perfect. Now we're going to take a picture of the left eye.
The retinal camera is an exciting new way to detect eye disease. The retinal photographs are taken in the pretest room, but I can easily access the pictures from the exam room and show the patient exactly what's going on with their eye. This is a patient I saw recently. This is the patient's left eye. There's a large retinal hemorrhage above the optic nerve, probably due to a branch retinal vein occlusion. I can move the picture around, I can manipulate it, I can change sizes. I can very easily show the patient exactly what's going on inside their eye. One of the best features of digital retinal photography is that it allows you to superimpose one photo on top of another photo to see if there's any change over that period of time. The software creates a movie alternating from one photograph to the other. This is a patient of mine that has macular degeneration. I can select the photograph from this year and the photograph from last year, and then look for any obvious differences. In this case, there's no change. Well, that's pretty much what we do here all day. I hope you allow us to take care of your vision needs. We will take good care of you. Thank you.